Hello, Jonathan. How are you?
Cherie, so good. It's always wonderful being with you. And I always feel a little more grounded, a little more settled when we get to connect.
Thank you. Well, the feeling's mutual, as you know. We're going to just record for a very short few minutes talking about the heart of medicine next year and your work, which is so related to what we're hoping for at this event in Central Australia. I wonder if we could start by asking you, you've written a fabulous book, Just One Heart, and I want to tell everybody that Jonathan is a cardiologist in North Carolina. He's a wellbeing leader in a large health organisation and really in the world in lots of different places now because of your good work, Jonathan. And so an author, a cardiologist, a wellbeing leader, you've got a lot to share with us. What's happened since you published your book a bit over a year ago in the conversations with doctors and nurses particularly? What sorts of things are you hearing and learning?
So we are coming out of the COVID era, and the book was published partly in response to that as a signal and a message of hope that was rooted in the science of how our minds and hearts are connected, kind of bringing us together. And writing the book was part of my own recovery from burnout. I've had a chance to speak with thousands of nurses and doctors and healthcare leaders over the past year, and the reception has been very interesting. I thought that people were going to want to talk about all of the data and the research about how certain emotional states were leading to cardiovascular health or disease. What people have really leaned into are these 7 timeless traits of the heart, which came up in my work as characteristics that historically are associated with the compassionate heart, whether we're looking at Hinduism, Buddhism, Judaism, Islam, any wisdom tradition, and how today's best leaders in healthcare and beyond manifest these traits. So it's really been quite striking that people want to experience these traits even more than getting into the nitty-gritty science.
Isn't that fascinating? I think that's one of the beautiful things about your book, Jonathan, that it is very grounded in science. And I know that you did lots of interviews and took a long time to do the research. And so there's a confidence probably that people don't need to talk about
Mm,
more because you've really distilled it so beautifully in your book. And
mm.
that allows us, doesn't it, to move then to perhaps the deeper questions or the more meaningful questions. I love how you've framed that. So
Thank you.
I'm wondering with the big systems, the big health systems, how can they really move to kind of cultivate and be proactive about developing these workplaces that are more heartfelt, that we can be heartful in our practice. We can be connected not just to our patients, but to each other in this really meaningful work that we're all endeavouring to do in healthcare. How can organisations create spaces or workplaces for more of this?
When I think about how an organization can create a culture that is compassionate, that's kind, not only caring to the patients, but in particular caring to those caring for the patients, the physicians, the nurses, the APPs, the team members, the managers in the front and the back of the office. It all begins with a shift in a basic assumption. Rather than beginning with a stress management program, those are important, or a leadership program, a shift in a basic assumption is that it doesn't take a lot to allow people's natural empathy and compassion to shine through. It doesn't take $1 million. I think when we start with that belief that the people who choose to go into medicine already have a natural calling from the heart to help others, to serve others, to care for others, we simply have to create spaces where these people can do what it is they're called to do, what they're best at doing. And it's really more about those spaces. What do they look like? What do they sound like? What are the messages that are being spoken? And how are the leaders behaving in those spaces so that people's natural empathy and compassion can shine through? And at the same time, we know that from day one of medical school, the natural empathy that is there, that's innate, that we all have, begins to erode because of a variety of factors. The stress of medicine, the stress of facing life and death, the organizational factors, which can be overwhelming, the governmental and financial headwinds, which we're all facing. We know basic psychology says that when we feel stressed and worried about our own survival, we become naturally less concerned about the well-being of others. And yet, when we're armed with that information and the basic skills of empathy and compassion for ourselves and others, we can use that as an antidote for whatever pressures come our way.
You could almost stop there, Jonathan. It's so powerful what you're talking about. This idea that we can just, that people naturally want to be connected. They want to be working together and meeting each other heart to heart and, mind and body all in, wholeheartedly, whole-bodedly in terms of being present with each other. And this idea that we've kind of made it more complicated than it needs to be.
Yeah, we have made it more complicated than it needs to be. And we also have applied a traditional business model, which is rooted in capitalism and profit and investors and third parties. And that has, I think, in many ways started to cover over the oaths and the promises that we all made when we went into this field, which is first, do no harm. Well, many of us experience moral injury in addition to burnout because we are doing harm in many ways by causing delays in patient care, by charging prices that we would otherwise not charge, making care inaccessible to some people, and overall making patients feel like cogs in a machine rather than the human beings that need healing, just like we on the healing side.
And we're certainly seeing that with the people who are registering for the expression of interest for the event. They're certainly making exactly those kinds of comments that the distractions of healthcare are impeding what they really want to do in their work. What do you think can happen when we come together in a sacred place like this together, a group of healthcare workers from all different places geographically and all different parts of professionally, different crafts? What do you think can happen in terms of love and well-being and connection for the individuals who will gather at the Heart of Medicine, but perhaps more importantly for their organisations and their communities, the patients after they leave, having been in a place like this that's essentially for connection and reconnection? What can happen after the event, do you think?
I'm trying to answer the question with my rational mind, but my emotional heart is getting so excited thinking about not only what can happen, but in my perhaps overconfidence and experience, I know what does happen because I've hosted retreats before and I've brought healers together in a sacred space, as you say, and I've witnessed what happens. And I've also seen the ripple effects in the organizations when these leaders rediscover empathy and compassion for themselves, reconnect with their core sense of purpose, develop a sense of personal empowerment that often has dissolved into a hopelessness and a sense of being forsaken. When all of that is replaced with a reconnection with self, with a recovery, with a restoration of the spirit, and particularly with the connection with colleagues from around the world, there's something amazing that happens. The sense of community that we are longing for, and a sense that there is hope for a future healthcare system, which will have many flaws and will have leaders who are quite focused on what's most important, which is helping create spaces for healing. And those same spaces, and I've experienced this, those same spaces that allow patients to heal, not just broken bones, but broken spirits, especially when there's chronic disease. Those same spaces, evidence shows, helps reverse burnout among the providers and the physicians and nurses themselves. This is what we've been craving all along. And when we go back to our organizations, there are tangible benefits. People don't leave as much. They don't have the intention to leave. They create an environment where someone who's interviewing is more likely to take the job there. It's easier to recruit to these organizations when we have a culture of compassionate leadership led by the caregivers themselves.
Yeah. Oh, I'm excited too now. I can't wait. A year's too far away. Okay, thank you very much for your time, Jonathan. I want to just show your book again and really encourage people who are interested in the things that Jonathan has just said. Please have a look at his book, Just One Heart. You'll get lots of value out of it, personally and hopefully in your wider circle. Share it around, tell other people about it. Jonathan, I can't wait to be with you next year in Australia. I'm really grateful for your time this morning, and please, may you be well.
Sherry, thank you so much. I'm so grateful that we discovered each other years ago and that we continue on this journey together.